So we're going to talk about the ultrasound guided axillary nerve block. This is the axillary nerve supplying to the shoulder joint and not the axillary brachial plexus block. To perform this block, the bony landmarks that you need to be looking for on the ultrasound is the head of the humerus and the shaft of the humerus. When you put the ultrasound probe on the junction of the head and shaft of the humerus, moving the ultrasound probe down, you will be able to see a vascular structure, which is the posterior circumflex humeral artery branch. And there'll be two muscles, the deltoid muscle that's coming on the top and the teres minor muscle, which is a lens-shaped muscle which sits just on the shaft of the humerus. And looking at those two muscles along with the vascular structure is your landmark or a target to perform the injection, as the axillary nerve accompanies the posterior circumflex humeral artery. How to perform this injection? You can perform the injection either with an out-of-plane technique, or you can perform the injection coming from inferior to superior with an in-plane technique. So this injection you can perform in the lateral position, prone position, or the sitting position. The volume of local anesthetic is about 4 to 5 mL with steroid depomedrone or Canalog. I'm going to show you the axillary nerve block. To perform this block, patient will be sitting arm in the neutral position, palm facing up. Feel for the humeral head. Your ultrasound position will be on the top of the humeral head. Here we have the humeral head that's coming into the view. Once you have put the probe on the humeral head, move down the humeral head and look for the humeral head shaft and the condyle junction, and you will come across an arterial pulsation. That's the posterior circumflex humeral artery as shown in this image here. I'm going to reduce the depth in order to make the picture more clear. And here we have the posterior circumflex humeral artery, and next to the artery is usually the target for your axillary nerve. So you can bring the needle out of plane, or you can bring the needle in plane from distal to proximal, coming and targeting the axillary nerve. This is the axillary nerve supplying to the shoulder joint. If you move the probe a bit more distally as well as posteriorly, you should be able to see another muscle, which is the teres minor muscle, which is shown here in this image. And also the superficial muscle is the deltoid muscle. So you have the deltoid muscle, teres minor, you have the posterior circumflex humeral artery, and the axillary nerve, all shown in this picture. I'm going to freeze the image and label them for you. So the humeral head, shaft, posterior circumflex humeral artery, deltoid muscle. This muscle here, the small muscle, is the teres minor muscle.